Hi everyone, I am Dr. Amala and today we are discussing about something that a lot of our parents, our relatives are quietly struggling with, that is knee osteoarthritis. So now don't worry, I'm not here to throw big medical words at you. I'm here to explain what osteoarthritis is and why your knees may be protesting every time you climb stairs and what you can actually do about it. All in simple, practical language. Let's get into it. So first things first, what is osteoarthritis? So imagine your knee joint, it's like a well-made machine. Two bones moving very smoothly over each other, thanks to a soft layer called cartilage. This cartilage is like a cushion or a shock absorber of your joint. Now with osteoarthritis, the cushion starts thinning out. Slowly the bones begin to rub against each other. And that's why you get that pain, that stiffness, something like swelling, and over the time the joint becomes less flexible. It doesn't feel great, right? People often think of it as aging of the joint, and yes, age is the most common reason, but it's not the only one. It's not something that suddenly shows up one morning. Our knees have been serving us loyally for decades. But then there's also body weight. The more weight you carry, the more stress your knees take. So what about previous injuries? Yes, your knees remember those. Any fracture or any ligament injuries from years ago, even if it is healed, can make your knees age faster. Some people have joints that are more vulnerable thanks to genetics. And finally, the repetitive strain, like your job, your lifestyle involves a lot of squatting, kneeling, or like lifting heavy weights. That too wears the joint down. So what are the symptoms? How do you know if you have an osteoarthritis of the knee? Well, the first sign is usually pain, especially during or after activities. Like maybe it starts with just a little discomfort when going upstairs or getting out of a low chair. Like people often say, once I start walking, I get better. So that is the typical thing. You might also notice a little swelling or even hear a grinding sound, a bit like a bubble wrap. That's the bones talking to each other, unfortunately, without the cartilage to buffer the conversation. Now, as a doctor, with the help of the history of the patient, with the help of the clinical examination, I'll ask the patient to take an X-ray straight away. It's like a Google map to get the diagnosis of the patient. And in that, ta-da! There is joint space narrowing because there is no cartilage. So what is the treatment for this? Is it reversible? Let's talk about it. The good news is most cases do not need surgeries. So as with the X-ray, we have certain grading. So grade 4 mostly requires surgery. We won't have to talk about it. Negative. We start with simple but effective things like movement, strengthening, and lifestyle changes. Exercise is one of the best treatments. No, not running. Don't worry, I am talking about low impact exercises like walking, cycling, and most importantly, strengthening the muscles around your knee, especially the quadriceps. They act like the bodyguards of your knee joint. But very importantly, the weight management. I always tell patients, losing even 5 kilograms can reduce the pressure on your knees by 2 to 3 times that amount. If the pain is affecting your day-to-day life, we might recommend a short course of pain relievers like paracetamol, which is the drug of choice, or mild anti-inflammatory medications. And some people benefit from using knee brace also, or even walking stick. It's not a sign of weakness, it's a smart support. And yes, in some severe cases, when the joint is badly damaged and nothing else helps, like in grade 4 osteoarthritis, when the joint space is completely gone away, like no space at all, knee replacement surgery is an option. See, as the proverb says, prevention is better than cure. And if your knees are fine right now, let's keep it that way. Stay active, but choose activities that your joints enjoy. Keep your weight in check and avoid deep squatting or sitting on the floor for long hours, especially as you age. And if you ever feel knee pain that doesn't go away, please don't ignore it, because the earlier we intervene, the better we can manage it. So, in summary, osteoarthritis is very common, but that doesn't mean it's something you have to silently suffer through. With the right care, your knees can carry on comfortably for many years. If you found this video helpful, please give a like, subscribe for more health tips, and share this with someone whose knees are sending them warning signs. I'm Dr. Amala Sajeev, and I'll see you in the next one.